New at 6, over the next year, the state will begin scaling back health care coverage for potentially hundreds of thousands of Arizonans.
It'll mark the end of a COVID-era policy that kept Medicaid recipients covered with no questions asked. Team 12's Joe Dana is here tonight. And Joe, the state is now asking questions, and Arizonans will have to provide answers.
And the quicker they get those answers, I think the better for everyone. More than 2.5 million Arizonans are covered by Medicaid through the state's Access program. Beginning in April, the state must update the Medicaid rolls for the first time since before the pandemic. Many will no longer qualify.
We understand that this takes time.
Christina Corriere knows a massive job is ahead for the state. As Doug Ducey's top health advisor during COVID, she helped implement emergency Medicaid coverage. Now she's lobbying on behalf of medical professionals as the state begins the arduous task of figuring out who no longer qualifies.
Every state is going through the same process right now. There may be hiccups in that process.
In Arizona, 600,000 people became eligible for Medicaid during the pandemic, who the state now believes may no longer qualify.
There are hundreds of thousands of children. There are elderly, there are people that are pregnant or have cancer, and we want to make sure that everyone has a fair hearing to make a determination on their specific case.
Those who make too much to qualify will lose Medicaid coverage. They will need to sign up for the insurance marketplace or their employer's insurance. The state has 13 months to close down emergency coverage entirely, though some legislators want to shorten the deadline to 10 months. Corriere and others are urging legislators to find a compromise that ensures the state doesn't rush the process.
It's really important that we do that individualized review.
The economic impact of a drop-off in Medicaid coverage is not clear. Hospitals, doctors, and nonprofits are bracing for a drop in coverage. Children's advocates worry most about kids losing consistent care. State health administrators are stressing this does not mean Medicaid coverage ends on April 1st. However, that is when the de-enrollment process begins. Family advocates say Native American and Hispanic families are at a higher risk of losing Medicaid coverage.
Okay, so Joe, with all of this happening then, what should people do if they are on Medicaid?
Well, first of all, look for a letter in the mail from the Department of Economic Services or from HCCS. They'll be trying to contact you in the coming weeks. Second, you can also just call one of the numbers on your screen or go to the website. They'll need to confirm your financial status if you're on Medicaid, no matter what. The hope is the state will properly confirm the status of first those who are in limbo and eventually all 2.5 million Arizonans over the next year or so. We don't want to see people surprised that they suddenly lose Medicaid coverage. So this is an effort to really get the word out. We'll have more of that information you see there online at 12news.com.
All right, Joe, thank you so much.